So I'm here. I've never done any kind of partisan speaking in my life. I read all the health policies, all the healthcare policies for all the parties. Et en plus, j'ai beaucoup lu, pas seulement des partis maintenant au Canada, mais aussi Mexique ou France, des pays comme ça. And I have to say, in all honesty, this is the best healthcare policy I've ever read in my life. I mean, when I just saw Elizabeth, I said, who wrote this? This is amazing. It has all the latest research, tous les recherches internationales, surtout qui vient. Most of it comes from WHO, the World Health Organization, from the UN, but also very famous bodies like the Harvard School of Public Health, les endroits comme ça. En France, vous savez, France est éblouie d'admiration pour le système canadien de santé. Est-ce que vous savez pourquoi? Parce qu'on ne laisse pas tomber personne. In France, they have what's considered by many to be the best system in the world, but it is still partly public-private, which means that the working poor, the very poor are taken care of, the very rich have their insurance mediated by the government, not by itself, but by the government. But the working poor, they fall through the cracks. Donc, ils sont éblouis par nous. The health director of public health for all of France, le Vieille Santé, en France, m'avait donné 3 heures de son temps comme ça, parce que je viens du Canada, et elle était tellement éblouie par notre système qu'on est en train de couper, de mordre, de perdre. So this is the main thing. The one other thing that I would like to mention is the power of the drug lobby. And I think most people are not aware that the chemical pharmaceutical industry, l'industrie pharmaceutique, c'est l'industrie le plus riche et qui a le plus de pouvoir de n'importe quelle industrie du monde. Most people don't realize that this industry is more powerful than oil. It is more powerful than gold mining. It is more powerful than arms dealing. This is the richest industry in the world. So do you think they might put political pressure on countries to get their way? And statistically, ils savent très bien, l'industrie pharmaceutique, qu'ils ont moins de profit avec des systèmes single payer, avec des systèmes de gouvernement, parce que le gouvernement a plus de pouvoir pour faire des arrangements, comme dit le prix, et aussi font des recherches si les médicaments sont efficaces. And the drug industry always tries to get privatization put in because they have way bigger profits, as you know from the Americans who run to Canada to buy drugs. So these two things, I suggest every Canadian, tout le monde doit lire la politique de santé du Parti Green. Even if you're not voting for some reason in this election, read it, parce que ça, c'est la politique qu'on doit avoir.
Et je vais ajouter quelques mots au sujet de l'industrie pharmaceutique. C'est une industrie avec trop de pouvoir ici au Canada. Et les coûts pour notre système de soins de santé publique, les parties qui ont la croissance plus vite, plus grande, c'est les coûts pour les médicaments. C'est à cause de le pouvoir de l'industrie pharmaceutique. For every single doctor in Canada, there are 2.5 drug salesmen. Every single doctor in Canada is lured with ideas of conferences they can attend that the drug companies pay for. There's a deep conflict of interest, and Health Canada is not doing an adequate job. They are not performing due diligence on the evidence-based job they should do to review the applications for drug approvals in this country. J'ai eu une réunion très récemment avec un groupe à l'Université de Colombie-Britannique qui s'appelle l'Initiative Thérapeutique. Et il y a un groupe de scientifiques qui fait leurs recherches sans accepter un sein
En sous.
Une sous d'industrie pharmaceutique. C'est le seul groupe comme ça, parce que tous les autres ont les conflits d'intérêts à cause de la richesse et le pouvoir de l'industrie pharmaceutique. In North America, it's estimated that every year 150,000 people die from using prescription drugs as prescribed. We have a really large issue here, and I wish, as I've been looking forward to trying to raise this in the leaders' debate, what we're doing with our healthcare system and why we are not getting a handle on the fact that right now 20% of the costs of our healthcare system is the cost of prescription drugs. So, le Parti Vert ont proposé maintenant d'avoir un programme universel d'assurance médicaments avec un programme plus fort pour vérifier les demandes de l'industrie pharmaceutique, pour vérifier les bénéfices de nouveaux médicaments, pour protéger la santé contre l'intérêt d'une industrie avec si grand pouvoir que l'industrie pharmaceutique. Et alors aussi, nous avons un programme pour mettre sur pied un organisme d'achat des médicaments en vrac pour réduire les coûts pour chaque médicament. We've based this part of our platform on a universal pharmacare program that reduces the prices of drugs on the experience of the Clinton Foundation that managed to get the pharmaceutical industry to reduce by as much as from a $10 cost to a $2 cost. That's just as an example, by large amounts of reductions, because the Clinton Foundation went to the pharmaceutical industry and said, we need to get retroviral drugs to Africa, we need to get HIV testing to Africa, and the prices you're demanding are too high. So rather than deal with the pharmaceutical industry by demanding that they, have some sense of moral conscience, the Clinton Foundation said, look, we'll meet a good price, we'll pay up front, we'll negotiate in bulk, we'll guarantee the price, and the prices fell to levels that could be affordable. The government of Canada could establish a Crown corporation to bulk purchase only those drugs that we have verified will do more good than harm, bring the price down, and then for those Canadians who have trouble meeting even those prices, we'll include that we have a universal pharmacare program to help Canadians so the price of drugs will not leave our seniors, as I know people who go through the experience of trying to decide whether to buy their drugs or their food. Now, we're a wealthy country. We shouldn't stand for this. So there are a lot of aspects to our healthcare program. I'll certainly stop and answer questions. But I did want to mention, because Holly mentioned what had happened in the 1990s with losing 20% of our hospital beds in 1 year. We want to reduce wait times, and the way to do that is to build into the system more beds, particularly for long-term convalescent care and for immediate convalescence after surgery and for long-term care. We also, in our program, call for a new emphasis, a significant emphasis on mental health and addiction help for Canadians. And particularly, and I just want to mention this, there's so many points to mention about healthcare, but I'm particularly concerned that we're letting down our adolescents. Les jeunes qui ont besoin d'aide pour les questions de santé mentale, pour les questions avec les drogues, on doit mettre sur pied un système qui a été créé seulement pour les jeunes, qui était efficace pour aider les jeunes avec les problèmes d'addiction, les problèmes de dépression. C'est très important pour sauver les vies de nos jeunes. We are letting down our young people. We need a significant emphasis on helping young people who are dealing with depression issues and dealing with addiction issues. There's much more to be said, mais maintenant, je vous donne la parole. Si vous avez les questions, s'il vous plaît, demande. Et c'est possible pour dire que la question c'est pour Holly ou pour moi, mais tous les deux nous peut ajouter les mots de temps en temps. Let me know if the questions are for Holly Dressel or for me, but we'll do our best to answer anything you ask. Il y a les questions?
Oui.
Oui.
Bonjour.
Oui.
Okay, my name is Danielle Rachet. I'm reporter for APTN, Aboriginal People's Television Network. So I would like to know, what are you planning for the Aboriginal people, which you know the cap is tremendous.
Yeah.
Tuberculosis, diabetes, suicide on the youth population. So,
Yeah, we've basically kept in the same kind of numbers that are appropriate under what was called the Kelowna Accord. We've been in consultation with the Assembly of First Nations and realized that the current ask is more directed towards education, clean drinking water, and decent housing. But the whole national, when we talk about a national strategy around mental health and addictions, that's for everyone, including with a focus on First Nations communities. So we have a significant amount of money put aside. By the way, all of this is costed and affordable, as I've mentioned earlier. Mais c'est un scandale, vraiment un scandale, la situation pour beaucoup des Autochtones autour du Canada. Et c'est une question de priorité. Où est le gouvernement du Canada, où il a la plus grande responsabilité, c'est pour les nations premières. The federal government has the largest level of responsibility and around First Nations, the condition in First Nations communities, the significant issue of suicides, particularly among young people. This is a focus in our platform in terms of funds directed to First Nations priorities, as we have understood them from the Assembly of First Nations, with a significant commitment of funds very similar to the Kelowna Accord, with the priorities that have been identified: education, clean drinking water, and decent housing. But our national program to assist in terms of mental health programs will also, of course, encompass a strategy and putting a priority on alleviating the conditions in First Nations communities. And thank you for your question, and thank you for being here. Miigwech.